Okay, it's my pleasure today in the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession to have with us Dr. Suresh Madhava with us, who is Dean at the University of North Texas in Fort Worth, Texas, outside of Dallas. For years, he was at West Virginia University as professor and chair of the Department of Pharmaceutical Systems and Policy. There, he established the PhD program in Health Service and Outcomes Research, and which at West Virginia was designated as a program of excellence by the West Virginia Board of Governors. He's trained and mentored hundreds of graduate students. He served on the editorial board of JAFA and also the Journal of Research in Social and Administrative Pharmacy. He's recognized for his research excellence, especially in health service and outcomes research, and a few years ago was recognized with the Paul Dawson Award for Excellence in Patient Care Research from AACP. So welcome, Dr. Madhava.
Thank you very much, Dr. Poirier. I'm very happy to be here, and thank you for the honor of talking to your students in your class.
Very good, thank you. So we'll start off. We'd like to learn more about your journey and your development as a leader in your area and recognition as a leader, an academic leader in outcomes research. And reflecting on that, you may wish to reflect on key events that shaped your journey or key persons that influence you in your journey.
Absolutely. So I have a great example of a person who knew exactly what he wanted to do in his career, but then ended up doing something very, very different. I decided to go to pharmacy school. It was with the idea of also finishing an MBA degree and then working in a pharmaceutical company. And I was particularly interested in pharmaceutical marketing. And this was back in India. And so I did exactly that. And then soon thereafter, I started to work for a multinational company for about 9 months. But while I was working in the capacity of a marketing services manager, I found myself to be not really challenged by what I was doing. And it just didn't seem to fit what I thought I was looking for. And so more out of a sense of adventure than anything else, I decided to apply to PhD programs in the US and apply to several schools. I was fortunate to be admitted to Purdue University, and I went there for 5 years and did my PhD. Although it was in the College of Pharmacy, a lot of my coursework happened in the business school, Cranach School of Business Management. And I was focusing again in the area of pharmaceutical marketing. My PhD dissertation work related to that. Again, my intention was to go into the pharmaceutical industry. However, as a teaching assistant there in the Doctor of Pharmacy program, I had the opportunity to lead recitation sections, work with students, and particularly in the last 6 months, I had the responsibility of working with a section of students, about 30 students, and I was totally responsible for everything related to the recitation activities. I really enjoyed it. And then as it got closer to graduation, I started to interview with pharmaceutical companies. I was at AACP meeting in Chicago where I was approached by the then chair of the Department of Behavioral Administrative Pharmacy at West Virginia University about coming on board there and looking and seeing if I was interested in going there. I was invited for a visit. I went. I liked it. And then again, I thought like, okay, let me try academia. I can always go from academia to industry if I'm not happy. It's more difficult to go the other way, in my opinion. But so I went there, told everybody that I wasn't going to be there for more than 2 years. And so didn't buy a house. People advised me to buy a house. So I was renting. And, but then that 2 years ended up becoming 31 years. And so I found my way into academia rather serendipitously and found it to be an extraordinary fit and enjoyed teaching. But more than that, I was surprised to find that I also enjoyed research, especially as they related to health services and outcomes research. And although I was trained in marketing research, I was able to apply what I learned to health services and outcomes research. But apart from that, I had the opportunity to build a PhD program and from scratch. And we admitted our first PhD student in 1989, who graduated in 1994. And then when I left a year ago, we had graduated about 45 PhD students and who have found terrific employment in the pharmaceutical industry, in academia, managed care organizations, and clinical research organizations. But more than anything else, I was also able to apply my MBA skills. I looked at academia a little differently from my other colleagues. I was always looking for that entrepreneurial opportunity to make a difference. And West Virginia was a great state, great people, great culture for me to be there and try some things without too much of a risk. And some of these things worked out really well, and was able to develop several large-scale statewide initiatives that related to improving medication use in the Medicaid population and the state government health insurance program. I was able to do some studies related to the role of pharmacists in immunizations, working with the American Pharmacists Association. So all of those helped. Again, my leadership route was kind of serendipitous too. In my third year, when I was an assistant professor, we had some people in my group. It was actually a very small department. Half of the department left. There was a hiring freeze. So my dean then, Dr. Alan Rosenbluth, asked me if I would be an interim chair for a short time. I talked to several of my mentors, then Drs. Pathak, Dr. Mickey Smith, who all advised me not to, since it was so early in my career. And I did the opposite of what they advised me to do. I said yes. And so ended up being an interim chair for 3 years, from 91 to 94, and then became the permanent chair in 94. So after the 31 years I was there, 27 years I was a department chair.
Wow. Wow.
Very unusual track, and not something I would advise a whole lot of people. But like I said, my career has been a series of serendipitous things that worked out well. And I also had the opportunity to go through the ACP Leadership Fellows Program. That was extremely helpful. And then a few years ago, I started to look at opportunities to become a dean, and then found this terrific match here at University of North Texas System College of Pharmacy, a great place, new school, part of a large university system, public university system, and we're just about ready to graduate. We just graduated this week, our 4th class.
Wow.
And we have a terrific group of faculty, students, facilities, and a great leadership. So all in all, it's worked out well for me. So that's how my career trajectory has been.
Very good. Thank you for that. So what do you believe will be your legacy in 20 years? And when I rephrase that question by asking, of all the things you've been involved with, what are you most proud of in terms of your contributions that has helped advance the pharmacy profession?
Sure. As I said, a lot of the opportunities that came my way related to helping to look at some severe problems of mobility and mortality in the state of West Virginia. And that's where my health services and outcomes research interests grew. And I was able to do a lot of things in terms of writing grants, building infrastructure and capacity to do health services and outcomes research. But while I was doing that, I was also involved in looking at opportunities for pharmacists in terms of different types of roles. Having never been a clinician myself, having never uh, uh, had a pharmacist license or practice in a community or a hospital um, pharmacy, I was interested in looking at what other opportunities there may be for pharmacists to distinguish themselves, particularly in a healthcare system that needed important access to healthcare in rural areas. And so I was involved in a series of projects. The one that comes to my mind is our grant from CDC. We looked at the role of pharmacists in childhood and adult immunization. This was in '95. And we worked with Lucinda Main at the American Pharmacists Association to put together a grant for a 5-year grant. And later on, I was told that it was one of the impetus to CDC recognizing the role of pharmacists,
Wow.
pharmacies in immunizations. I was also involved in working with our state Medicaid population to build a pharmacist call center. Where we did prior authorizations for Medicaid patients. And in the end, we also worked with the state government health insurance program. And in the end, when I left, we had about 10, 11 pharmacists and about 7 pharmacy technicians that provided close to 300 to 400 prior authorizations every day. And that was also reported in national newspapers about one of the ways that West Virginia was able to save some $50 million in 2017 in their Medicaid drug budget. Then a third thing I'll mention quickly is that working with the state government health insurance program, we created an academic detailing program where pharmacists would go into physician offices and detail about the safe, rational, cost-effective use of medications in 5 therapeutic categories where there were high-cost, high-volume drugs. And that program lasted for 3 years. It was recognized by the Council of State Governments with an Innovation Award. Unfortunately, as it's prone to happen in state governments, when the governor changes, the people who are in various administrative positions, they change. And when that happened, that program could not be continued. But we were able to demonstrate that by tracking physician prescribing behavior in the 2 cities where we implemented the program, Morgantown and Charleston, that there was a noticeable decrease in high-cost medications that had just as good, if not better, less expensive or generic medications available to treat patients. And as you know, it's important that one of the factors that influences patient adherence to medications is cost. If they can afford it, they're likely to stick with that medication regimen. So those are some of the things we did as part of our interest in looking at enhancing or expanding pharmacists' role in the healthcare system. So that was at West Virginia. Here, if you're looking at, like I said, this is a very new College of Pharmacy. If I were to look 20 years ahead, what I would hope to see is that we have an outstanding Doctor of Pharmacy degree program that recognizes the importance of training pharmacists for contemporaneous pharmacy practice. Yes, today there is some degree of concern about opportunities in the community pharmacy setting, but still, when I look at all the data and when I look at the enormous need for pharmacists in the healthcare system, the cost of medication misuse, misadventuring, inappropriate prescribing, adverse events, when I look at that, I see there still continues to be a great role for pharmacists, and then they are the best position to help deal with that. How we do that is entirely up to us, the profession. And so the things that we are working on is being able to identify those kinds of career opportunities for our students so that we can prepare them for those types of careers. I think a lot of students come in with kind of a limited view of what the opportunities are, because that's what is most visible to them, the community pharmacist or the hospital pharmacist. But there's the beauty about this profession is there are so many choices. So I'd like to prepare them for those diversity of choices. I have very junior faculty who are really outstanding and innovative. I hope that 20 years from now, if I'm still there, that they are successful leaders in the profession, whether that's in academia or the industry or practice, and they're making substantial contributions in those areas.
Excellent.
So those are the two important things from my perspective. I think in the end, it's all about people.
Absolutely. Thank you very much. So the next question has to do advice for students in their journey as they develop as leaders. And we talk leaders, often it's the little L to help advance the profession. What advice do you have? As a dean, you definitely have lots of advice. And
so I think we do a lot of things for our students in our educational programs. We talk to them about the importance of leadership skills. We talk to them about the importance of good communication skills, big picture thinking skills. I think those are all very important. But just based on my personal life experience, I think both colleagues or leaders, I think they must possess three very important traits to be successful in today's work environment, and regardless of what area it is. And I think the first thing that comes to mind from my perspective is they have to be competent. They have to be smart. And so what do I mean by that? Certainly as a pharmacist and a healthcare professional, they have to keep up with all of the changes that are happening almost every day. The velocity, the volume, and the variability of information that come to us is quite substantial. And being able to stay abreast of that is important. But being smart is about more than just having that knowledge base and keeping up with knowledge. It's about also being a good listener. In order to be a great problem solver, you have to be a good listener. I think it's important that with that knowledge base that you're able to have common sense that comes with that. A lot of times people they're experts, yet they cannot explain what they know to people who need to use that information. So common sense is important. Ability to simplify complex issues, particularly as they are dealing with other healthcare professionals or their own patients. I think that's important. And just as important, it is in a leadership position, you have to be able to tell the difference between the important and the unimportant. Because of the volume of information, you need to be able to distill things that are not relevant to the issues or the problems that you're trying to solve. Second important trait, I believe, is dependability. Dependability means to get things done. Everybody around us depends on us to get things done in the way they entrust us with expectations, with responsibilities, and our job is to make sure that we get those things done. And it has to be done in a timely way. The pace of life and work is certainly faster than it was maybe even as recent as 10 years ago. So you have to be able to get things done. You have to be decisive. You'll never have complete information to get things done. There's always incomplete information, but you have to be decisive. You have to be a good risk taker. And in order to be a good risk taker, you have to be courageous about what you have and what you can do given the time frame for an important decision to be made. And in the end, you also have to be very self-sufficient, not go to your boss for everything. And you have to be relentless, be able to overcome the obstacles that come your way, whether it may be from people internal to the organization or people external to the organization. And the third and final thing I think that makes for a great colleague or a leader is that the person has to be nice. They have to be nice. And you cannot be a nice person if you don't like people. And to be a leader, you cannot be somebody who don't like people. So you have to like people, and you should know how to be nice. So, and in order to be nice, you have to show respect. You have to have integrity, a willingness to collaborate and learn. Certainly, I think I mentioned being a good listener. And you have to be able to learn to celebrate your peer success without jealousy. It is the workplace is a competitive place, but you need to have a genuine appreciation of all the things that your people around you do, and be able to applaud that. And then in the end, I think along with that is you also need to, while it's important to take your colleagues and your work seriously, you have to be sure that you don't take yourself too seriously. The ability to laugh at yourself, show humility, and be very, and not be status conscious. Okay, you may be the pharmacist or the chief pharmacist or the director or the vice president. All very important, but don't let that go to your head. So those are the three things that I think are important that kind of helps carve your trajectory in terms of leadership opportunities. But before that, you have to be a great team player and a great contributor. Yeah. And those other opportunities start to come your way.
Right. Thank you very much for those great insights. So the final question, as this is a history course, as we study the decade of the 2020s, one of the key events in that decade will be COVID-19 pandemic. Like other events in our history that have shaped our profession, this will be one that will shape our profession. So how do you see that being an opportunity for our profession?
That's, it's a little too soon to know, but this is what I would hope for. So, who would have thought at the beginning of 2020 that we would be straddled with this worldwide pandemic? And it's a mysterious disease manifesting itself in so many different ways. And even though the incidence rates are so high, we really don't know much about it. And while the whole world is trying to find ways to understand it better, find a treatment for it, find a vaccine for it, try to understand it better in terms of the likelihood of recurrence. All of those things, I think, are giving pharmacy an opportunity to really stand out and be visible. So, we all read about in the professional journals and in the media about the great warrior role that pharmacists are playing in the front lines of healthcare today. So in the community settings, they have become the go-to person for information, for addressing people's fears, their sense of how to handle conflicting information that comes across from various media. And so that role, I think, is a very visible role. In the hospital setting, they're becoming the source of information to other healthcare providers about the myriad of clinical trials that are going on to find a treatment and to find a vaccine. Mm-hmm. And so they are there to help inform, educate other healthcare providers in terms of what is believable from what we see every day. So those are, wonderful roles pharmacists are playing. in this regard. And then going forward, there are researchers, there are a lot of people who are in the research labs working very hard to find that breakthrough drug that will not only be effective, but safe, and then hopefully also cost effective, because in the end, that treatment has to go across the world, literally millions of people, and that vaccine has to serve the needs of 7.5 billion people. So there are researchers, pharmacist researchers who are trying to make an impact. So it's an extraordinary time. These are extraordinary opportunities. The professional organizations are doing their best to put the best foot forward, showcase what pharmacy and pharmacists are doing, as are academic enterprises. I'm hoping that it will change the trajectory of stagnant interest in the pharmacy profession among our student body. I'm also hopeful that it will create new job opportunities that will increase the demand for pharmacists in different ways. A lot of state governors have come out with orders to allow pharmacies to be a site for vaccinations, for example. That comes from a growing recognition that everybody, regardless of where they are, have a role to play. And who else but the pharmacy or the pharmacist, probably the most accessible healthcare professional that you can have, playing that role. And so, and I don't think this pandemic is the last one that we're going to see in our lifetime. I think there are going to be more. And then, like we did during the time shortly after 9/11, when we were concerned about bioterrorism and we saw a role for pharmacists to be in their communities, to be sources of information, be leaders in dealing with any kind of a bioterror attack. I think we're going to see a dramatically better understanding of the role of pharmacists in such pandemic situations. So I'm very optimistic that the future is good. And now I'm just waiting to see if the data will bear me out.
Very good. Well, thank you very much. I truly appreciate your taking the time.
Not at all. It's been a pleasure. And thank you for having me, and my very best wishes to you.
Thank you.